Welcome back. February is American Heart Month, and to help kick it off, the Heart Hospital of Austin is offering free heart screenings to student athletes ages 14 to 18 tomorrow morning. Joining me today is Dr. Vivek Goswami, a clinical cardiologist, to talk about the importance of this event. Thank you so much for being here.
Thanks for having me.
You guys did something similar before the start of the school year, before the fall sports began. Can you talk about why it's so important to get your heart checked at such a young age?
Absolutely. Well, hypertrophic cardiomyopathy is the leading cause of death, sudden cardiac death in young, otherwise healthy athletes. It's characterized by an excessive thickening of the heart muscle, and this excess thickening can predispose patients to a whole host of problems, including the potential of life-threatening arrhythmias. If we screen and can identify this process, we can prevent a lot of catastrophic events such as sudden cardiac death. It's often heart-wrenching when we hear these stories on the media of an otherwise healthy athlete collapsing and dying suddenly either on or off the field. And the really sad thing is if we can identify this process in advance, we can intervene and do things to prevent such a tragic event.
And it's known as a silent killer. A lot of times you don't see the symptoms. A lot of times there aren't any symptoms until it's too late and they end up collapsing.
That's unfortunately true. So a lot of patients with this underlying condition can have no symptoms, and sometimes the first symptom is their last, sudden cardiac death. For that reason, it's very important to be proactive with screening prior to the development of symptoms. With that said, if your student athlete at home is developing palpitations, racing heart episodes, chest pain, any passing out episodes, if there's a family history of sudden cardiac death, that should prompt you to talk to your son or daughter's doctor or see a cardiologist.
And not to detect it in the traditional physical exam either.
That's correct. So oftentimes a simple pre-sports physical can miss the underlying conditions. For that reason, at the Heart Hospital of Austin tomorrow morning, we're providing screening ECGs or electrocardiograms in addition to screening echocardiograms, which are ultrasounds of the heart. These are the gold standards for defining patients with hypertrophic cardiomyopathy, thereby screening them for this potentially very dangerous process.
And that's a non-invasive, very painless procedure, by the way.
That's correct.
There's also going to be CPR and AED tutorials on site.
That's correct. Yeah, so this is a very important thing to be integrated in a lot of school systems today, and for people to know adequately how to use those devices is very important.
Absolutely. Life-saving measures right there. In fact, there's an AED on every high school campus within the UIL. That was a rule that was passed a couple years ago, so obviously noticing the importance of having that equipment on hand. Thank you so much, Dr. Goswami, for being with us. Again, heart screenings tomorrow morning. For more information, you can go to the hearthospitalofAustin.com. And it starts at 8 o'clock tomorrow morning?
Starts at 8 to 12. There's still some spots left. And if you miss tomorrow or if you can't make it tomorrow, we do have some other screenings in the future. And please contact the Heart Hospital of Austin for more information.
Wonderful what you guys are doing. Thank you so much.
Thank you.